Hi everyone and welcome to Tough Start Live. I'm Maria Delaney, an investigative reporter for Noteworthy, and I worked on our Tough Start project with Michelle Hennessy from the Journal, who also joins us here today. And over the past few months, we joined forces to work on an extensive project which found that traveller children face shocking obstacles in every aspect of life we examined. And today we're joined by two people who helped us with our project, Mary Nevin, who's a community development worker with the Longford Traveller Primary Healthcare Project, and Anne Burke, who is the Education Coordinator for the Traveller Visibility Group in Cork. And Anne and Mary, thanks for joining us today. And before I go to you, Michelle, let's have a quick chat about our Tough Start investigation. And one thing I noticed a few months ago when we were crowdfunding for this project, as Noteworthy is a crowdfunded platform, was there's an appetite there from the public to investigate this, as every time we pushed it out on social media, we received contributions to help fund it. And then it was fully funded at the start of the summer and we joined forces with the Journal. But Michelle, maybe you can tell us a little bit about how we then approached the project.
Yeah, I suppose it's interesting because Maria, you and I were talking about this earlier in the week, just in the run up to this, and we were remembering the kind of early discussions we had, which feels like a long time ago now, way back when we first started the research for this. And we were just in the beginning stages of talking to some of the advocate organizations and, sort of local community workers. And at that stage, I think we were kind of nervous about even taking on a project of this scale about a topic that can be so sensitive and that is about a group of people who are so vulnerable as well. I mean, Maria, you and I had a lot of discussions about the fact that we were really conscious that both of us are settled people who were going to be writing about traveller issues, and like I said, big issues that affect a very vulnerable community. We don't have the lived experience of any of that, and we therefore can't be an authority on that. So it was really important from day one for us not only to have traveller voices in the pieces that we wrote as much as we could, but also to be led by travellers in terms of what we covered and where we went to go and find out information about those things. I mean, we were conscious as well that, and I think it's important to say this, the media has in the past and still continues to get it wrong a lot with this community, and that does a lot of damage, and we didn't want to be part of doing more damage by reporting things in the wrong way. So even in terms of the terminology that we were using and who we were talking to, that was all really important to us all the way through this.
Yeah, and moving on then to the Finney series, which was published this last month. We had a strong start with you, Michelle, interviewing Minister for Children, Roderick O'Gorman. What did he say to you?
Yeah, I mean, it was a good, strong interview, actually, and it was a great way for us to kick off the series because I think it drew attention to it before we even got into the other stuff that we've been investigating. We had a minister commenting on the types of things that we've been finding. So Roderick O'Gorman said that there's no question there's ingrained institutional racism against the traveller community in Ireland, which is a very strong statement from a government minister. He also said the state failed those children and failed successive generations of children. And the government wants to break that cycle. So that's another pledge, and we have heard this before, obviously, from previous governments, another pledge to end this cycle. The minister also spoke about a report by the Children's Ombudsman, and people who are watching might be familiar with this report about horrendous conditions at a Cork halting site, that was Spring Lane. And Cork City Council hit back at some of the findings of that report in a letter to the government. Now, I asked the minister what he thought about the fact that the council had sought to defend itself from really something that is indefensible. And he said he was surprised and he didn't really see that there was any reasonable defence for the types of conditions that the children on that site were living in. He also said there was a responsibility on local politicians, despite any pressure that might be from the local community, to stand up for the travellers in their constituencies.
And Anne, how significant is a comment like that there's ingrained institutional racism against the traveller community from a minister?
First of all, Marie, could I just say personally and on behalf of my organisation, a big thank you to yourself and to Michelle and to Noteworthy for such a comprehensive, honest report that really showed the depth of the issues that we face. And thank you for listening to us and thank you for voicing that for us. For the minister to say that is huge, Maria, because 30 years an activist, the dogs on the road, the politicians, I work at local level, regional level, national level. There is no politician that doesn't know what Roger O'Gorman knows and what he's saying, you know, that's the root cause of everything, even though nobody would admit it. And I was very grateful to him for having the honesty and the integrity to say that as well, and to say it so publicly, because if we are not looking at root causes, then we're always looking at symptoms, we're always patching things up, and that's the way it's been for the last 30 years, and it just simply can't go on like that.
And Mary, like, is this more talk without action, or like, how did you feel when you actually heard that?
Just to reinstate what Anna said, thanks to Maria and Michelle for the hard work getting us involved in it, and coming from where I work, my team members are delighted with this. So I suppose for us, we welcome like the statement from the Minister. We think it is a positive step forward. However, such statements have been made in the past. Speaking on behalf of the people I work alongside, they want to see action. Like that, this is the main thing. We want to see the steps that are going to be put in place to break this ingrained and Semitic racism. Racism itself is still happening, as we all well know. It has devastating effects on my community, which is the traveller community. Racism is associated with like anxiety, depression, suicide, asthma, physical illness, heart disease, increased blood pressure, excess body fat, poor sleep, and increased in alcohol and drug use. So I suppose for me, from my community and coming from Longford, we're saying we need action now, not words. Words have failed us in the past, you know. So,
and 10 years ago, when the All Ireland Traveller Health Study came out, you know, it isn't that every day of my life I will experience racism. It's every day of my life I will go out expecting to experience it, because there is potential there all the time. And that bears down on you, you know, on all travellers. And that's reflected in the suicide rates and the mental health rates among travellers, you know, to live with that constant fear that wherever you go, you can be targeted simply because of your ethnicity.
Yeah. And Anne-Marie, thanks very much for those comments. And I think thanks is to you and every traveller who we spoke to, like for their time. That's where we should be thanking. But and yeah, we'll come back to health a little bit later. But Michelle, we also tried to arrange an interview with Minister for Education Norma Foley, and maybe you can explain the lengths we went to and how we got on.
Yeah, I mean, there was a really stark contrast between the experience we had trying to get commentary and an interview with Minister Roger O'Gorman and the attempts that we made with Minister for Education. And actually, the education piece in this series was the biggest piece of work that we did. And I mean, the findings were very serious, which we'll get into later. But I had put in a request for interview with Minister Norma Foley weeks ahead of our publication date, and actually the publication date for that piece was pushed out a bit, so they actually had it even longer in the end to get back to us and to arrange that interview. 5 weeks after the initial request, we were told she wasn't available, and up until that stage I hadn't really heard much. And you know, the contrast there was with Roger O'Gorman. It was almost instant that I got a yes, he will do an interview, let's arrange a time. Now, with Minister Foley, we were told we could send questions, which we did about 10 days in advance. And again, by publication date, we still didn't have an answer. What was interesting was that after we published the piece, and this piece, we included a lot of mentions of the fact that we hadn't had, you know, a response to this part, that we'd asked the minister and she didn't respond. And it was after the publication that included those mentions of the lack of response that we got a very detailed and very lengthy response from the department. But, you know, that was added into the piece afterwards. But it can be hard when you do big investigations like this to get a response to these things. And, you know, is it an indication of how seriously or not they're taking the issues at hand?
Yeah. And I suppose just sticking with that piece, then the piece that you're talking about there, like this education's been an issue that traveller organisations have been campaigning to improve for years, and that's one of the reasons that it was one of our main pieces as part of this investigation. And yet, in spite of this, the last census showed that just 13% of travellers were educated to an upper secondary school level or above, but this was over 70% for the general population. But Michelle, like, what did we find when we looked into this?
So one of the big pieces in this that we looked at was the use of the reduced hours system. Now, this is something that we covered in greater detail in a special episode of the Explainer podcast. So if people want to hear more they can find that. This system of reduced hours, I mean, it's basically for children who would struggle to do a full school day. And there's an arrangement for them to either start later in the day or to finish earlier. And it really is supposed to be kind of a temporary measure for most children until something, sort of better supports are put in place so they can do the full day at school. But we've heard repeatedly that this system is being used disproportionately among vulnerable groups of children, and particularly traveller children. And not only that, representative groups and social care workers said it's also being used as a behaviour management tool rather than something that's based on the child's educational needs. Interestingly, a lecturer in TU Dublin, Deborah Brennan, who Maria, you had spoken to, she told us the worst example she heard was a child going to school for just 40 minutes out of the school day. We also found separate to that, and it's important for us to talk about the pandemic, I think, that there was a lack of support during the lockdowns for traveller children in particular, because, for example, they didn't have access to the internet, they might not have had the devices to use. Their parents may not have had the technical knowledge to help them with their schoolwork. They often weren't being sent any work at all. I mean, in some cases, there wasn't even really an attempt to find out what their needs were or to get them that work. There were over 60 children on one halting site in Munster that we heard of that received no digital supports, such as tablets and laptops. And that was something we heard consistently. And also that groups were really left, the sort of local community groups were left to sort that out rather than there being a kind of a wider system of figuring out what the needs were. I also spoke to some groups of traveller children. We did sort of focus groups because it was important for us, again, at the start of the series, to have as many traveller voices as we could, but also we were conscious we were writing about children and we wanted their voices to be represented as well, rather than just having adults speak for them the whole time. So some of the children who spoke to us for the series, they spoke about discrimination in schools. They felt their teachers treated them differently from the settled children. They gave out to them more, they said. They also said, which I found really sad, that they felt like the teachers and some of the grown-ups in their lives outside of their families just didn't expect them to do well. They expected them to misbehave. They didn't expect them to do well in school, perform well in school. And even more than that, they didn't expect them to succeed in their futures. They didn't ask them the same kind of questions about what they wanted to do for a career or after they left school, or whether they wanted to go on to college. And what's connected to that, which is something that we found, there don't really seem to be any policies in terms of teacher training when it comes to traveller children. And that's something that I know advocates and Anne and Mary will probably back this up, that they really want to see this kind of dedicated training there for teachers.
Yeah, and I suppose just focusing on the pandemic then, Anne, did you see that in terms of children in Cork, were adequate supports provided, or what happened in terms of COVID?
Okay, so I suppose just going back a bit, I am actually working on education for the past 2 years. Before that, I worked in health. Our projects are predominantly funded through health. A lot of our work is taken up with accommodation, firefighting all the time around accommodation. It's the big issue. Whenever we bring a group of travellers together to talk about health, talk about education, they want to talk about accommodation because that's the basic need. When we started working on education, I suppose the last time I would have been involved in education would have been when the visiting teacher service was in Cork, when there was more funding. And I did see a kind of a progression there and a movement. Well, certainly from where I started off with classes, prefabs out in the back for my children, I saw progression there. Austerity came and there was 90% cuts to traveller education. And I was actually shocked 2 years ago when I went back and looked at education again. Now I experience it every day with my own children, but sometimes you think it's just your own. But working with schools, looking at travellers in education, it's in crisis. And what we don't look at, and I don't know if you covered it in your report, is the historic abuse that we as traveller parents experienced in schools, and the trauma and how you deal with that trauma. How do we support our children in a system that has never been kind to us, that we've been probably damaged by? So how do we support our children in that? We see exclusion in the schools. We see exclusion having different faces, as I said, starting off with us, we were in special classes. It moved from special classes to reduced timetables, expelling traveller children. We find in the schools that we're working in, very few traveller children going beyond second level. And then COVID hit, and I suppose we were at a bit of an advantage in that we did have the NITRIS pilot here. We were able to support travellers. We have a very strong traveller organisation, and I would love to know, I suppose, you know, when the final analysis is there, what was the difference in having strong traveller projects in areas, because we provided a wraparound service to travellers. You know, we minded travellers in COVID, but where there wasn't those supports, I don't know how bad travellers were hit by it. I think travellers' mental health was very damaged during COVID with the media coverage, you know, to see excuses being made for settled people's bad behaviour, but travellers demonised, and armed response coming out to traveller sites, you know. I think that was a very frightening experience for travellers as well. But education, again, going back to what I said at the start, without dealing with the root causes, without, or the root, you know, issue there, the structural racism, without dealing with that, we're at nothing. We can patch things up as much as we want. We can get some funding. I know there was an announcement made today from Minister Foley of some funding for travellers in education. But we don't have a plan. We don't have a national education plan. The last time there was any strategy was in 2006, you know, and most of the recommendations of that haven't been implemented. So we don't have a plan to work off. So what's the point? It's like somebody described it yesterday as a smoke and mirrors thing. You know, these big headlines, travellers, this much money for travellers, that much money for travellers, but without an actual plan for us to work from, you know, with targets, with funding. And I would much rather see that funding held and pushed to that plan, you know, that we can work off of, that we can all work together from, and that can have a real impact. I don't see these bits of funding coming here and there having any impact on this issue. The issue for travellers in education is huge. It needs a huge response, and it needs us to be included in that response.
Yeah, and I suppose just going back to what you said at the start there, like it was very similar to what many adult travellers told us about how what happened to them in school impacted their trust on the education system. So I just, maybe you can go into a little bit more detail about your own experience in school and then how this informed your experience as a parent.
Okay, I had kind of a broken primary school, you know, but my memories of it, and you see, Maria, this is the thing for people who experience internalized depression. Sometimes people tell you they're being nice, but being nice isn't, you know, isn't helpful. It doesn't do, you know, sometimes you can do a lot of damage being nice. So there was a lot of nice people along the way who wanted to do this and who wanted to do that. So for instance, I remember being in primary school and living in a town where we were ghettoized in houses that didn't have bathrooms. And a prize was, an award was given to a teacher in school who had a prefab in the school made with showers to shower our children. And my mother asked the question, why can't you just give us bathrooms to wash our, we're well capable of washing our own children. In school, we would have been in special classes. We would have been left at the back of the class colouring, and that's not changed. I've been talking to an EWO recently who spoke to a secondary school principal who said that when the travel children come in, they have very low literacy levels. They can't manage in. So what happens there? What happens for traveller children? I work with a group of traveller women. And a few years ago, we did the Traveller Women's monologues. And one traveller woman spoke about her experience in school in Limerick, being segregated, being in a prefab at the back of the school, and a wall between in the playground where you couldn't interact with the settled children. You were slapped if you did try to go through the door to go where the second door. But this is the thing. Every morning when she got up, she said they were bused to school. And these are the bits that people don't remember. Local schools wouldn't accept us. They wouldn't take us. So including my own children, they were bused to a primary school that would accept them. When the bus came and they went, when they came back, she said it was often the case that the trailers would be moved on. And they would be so scared inside in that bus, wondering if they would ever see their parents again as a small child, you know. And these are her memories of school. And she would have no problem in saying she's totally traumatized. And she did send her own children to school, and she tried to engage in schools. Her children weren't happy there. There was nothing that reflected them or their culture in the school. They didn't feel they belonged there, you know. And And so they didn't go any further. They went through primary school, but they didn't go any further than that. So there's a cycle there. There's generational stuff there, you know. And how do we deal with what's happening today? Because always when we bring this stuff up with agencies, they say, oh, look, that was the past. Let's deal with what's happening now. But you can't deal with what's happening now without dealing with that trauma. We're finding it very difficult to engage traveller parents. I find it very difficult to go out and say, what am I selling to them? What am I selling to them? A system that's damaged them, a system that even if they do get through it, the likelihood is they won't get jobs. And the stats prove that. Is it 80-90% travellers are in unemployment? They say to me, what am I sending them for? And what am I getting up every morning and battling with my teenager for to go to school, knowing that there's nothing at the other end of it?
Yeah, and we're going to talk about maybe some solutions towards the end of this event. But I suppose, as you're saying there, like some of the things that we found was that traveller advocates reported an impact on mental health. And as you can see, obviously, like it goes back generations from discrimination in school. But when we looked into health further, we actually found that traveller children are facing poor outcomes across the board. Like it's not just mental health, it's lots of different areas. So Michelle, what did we find in relation to health?
Yeah, well, as you said, we found, outcomes across the board, but also that the disadvantage of the poor outcomes for traveller children begin even before they're born. Travellers have the highest rate of perinatal deaths of all ethnicities. That's the number of stillbirths and deaths from 22 weeks gestation to 7 days after birth. And the rate of infant mortality is also 4 times the rate of the general population. So, even pre-birth and then with babies, you're talking about the outcomes being disproportionate there. We also found that despite those stark figures, there's a lack of traveller-specific policies on ethnic identifiers in most health services. There was just one mention, for example, in the National Maternity Strategy of travellers, and that only related to the lower average age of the mothers giving birth. There was nothing else. The departments will always say, well, this sort of wider disadvantaged group, travellers fall into that, but there isn't anything specifically targeted at that individual group. Another area that we looked at was traveller health in the pandemic, which we touched on earlier. Now, people who are tuning in will probably be well aware that there was a big impact on the community, particularly in the early days of the pandemic. And travellers were among the hardest hit by COVID, with over 5,200 cases between March 2020 and April 2021. Now, that was 3 times the rate of the general population. And we heard from the HSE's National Social Inclusion Office that the official figures are probably just the tip of the iceberg, that they're not likely representative of the real number. And in terms of tracking that, it has been very difficult for the HSE. That they've said trying their best to be able to track that. And they said that the teams on the ground at an individual level do know what's going on. But in terms of wider national tracking, it is more difficult because their systems just aren't set up for that.
Yeah, and that was something, I suppose, because I did a lot of the data collection as part of this project, and it just it was so difficult to try and get traveller specific data, and just with the lack of ethnic identifiers, like you were saying there. And almost all travellers we spoke to called on the need for ethnic identifiers in all areas, like from housing to health to education. But Mary, maybe you can just talk a little bit about why this is important, maybe specifically in health, but also other areas.
I suppose the absence of measuring ethnicity remains an ongoing issue for our community. As a result of ethnicity being so rarely measured, it's very difficult, I suppose, to know if the needs of the traveller community are being met right across the board. So an ethnic identifier will impact state policies and responses, I suppose. An identifier will enable, I suppose, and assist services to deliver culturally appropriate and sensitive service to the traveller community. Also, it's crucial to address uniquely faced challenges by the traveller community. For example, just give you an example, in recent, where the absence of the official ethnic identifier was evident, was in the difficulty of accessing the impact of COVID-19 had on our community. The official data is not there. So the lack of the identifier is an ongoing issue, as we are well aware, for the travellers in relation to their accommodation needs, the non-existence of accommodation for travellers in so many counties all around Ireland. So I suppose an ethnic identifier is very important. it will assist the state agencies to have more relevant information in front of them. You know, sometimes when we're dealing with some of the state agencies, it's kind of an excuse on their part. They didn't put down the word traveller, we don't know, you know, it's hearsay. So I think this will take all this away. I think that all the agency will have a responsibility and to respond, and for this identifier to happen, and the state agencies themselves to take it on board that they have to have this. This is a must. It's not just of ticking a box. It's the point of having that right across the board in health, accommodation, within the schooling system. Like, there's so many statistics out there, but really and truly, we're always going back, you know, looking, we don't have this, we don't have how many numbers. Whose fault? We're not blaming. This is something going forward that needs to be looked at in order to make those changes and to make, I suppose, my community, our community as the travellers, a better outlook and a better, I suppose, upstanding for our children and our grandchildren. Like, our children, our grandchildren are our future. We have lived it, Anne. We have lived it, our children are living it. But I'm 54, so I have lived quarter or more likely more than half of my life at this stage. I would like to think for my children and my grandchildren that they will have equality and that this racism will be stamped out. Like, it's all going back to the one thing, I suppose, about racism. And, you know, in general, like, it's very easy to say it. Like, there's so many reports have come out, so many, you know, that have been printed and that have been reported. I have heard so many times people say to me, oh, it's so hard to read, it's unbelievable. And I do say back, try living in my shoes, living in that society, how hard and how difficult it is to bring up your children, you know, to have, I suppose, a good outlook on their life. And for me as well, it's respect. We need respect within all societies of life. We, as the primary healthcare team, right across Ireland, work with all other disadvantaged groups as well. But the travellers are the most disadvantaged in Ireland. And I think going forward, like, even just going back to some of the stuff that Anne said about schools, like, I remember going back many years ago, myself and a colleague, we done intercultural awareness in primary schools. I'll just give you an idea. And like, we were going in, and it wasn't just for the traveller children, it was for all the children. We would have started in first class. We decided first class would have been a great class. And we went in, we discussed traveller culture, and it went very, very well. And just at the end of it, we decided we'd go around the classroom. And it was a mixed classroom. We had boys coming from the traveller community, we had girls, and we had the settled girls and boys. And we just asked them what would they like to be when they grow up? You know, as children, you know, they have all their own little ideas and whatever. We went around that room, and every child in that room said what they wanted to be. Some of them doctors, nurses, footballers, teachers, whatever, doctors, guards, the whole lot, including the traveller children. But when we went back, we would have done it throughout the years, but we went back specifically when those children were in fourth class. And obviously the boys, some of them had gone to the boys' school, girls stayed in. So we went to both schools. And the same pupils in fourth class, the majority of settled children, obviously, at that time we wouldn't be remembering everything, but they had changed their mind on what they wanted to be. But when we asked, going around individually, what the traveller child wanted to be, they didn't know. So for me, what happened from first class to fourth class to that child, and go back to what Michelle had said earlier, like about the teachers being kind of shocked that the traveller children are going to school, they shouldn't know anything. Like, how are they going to learn if that teacher isn't putting that into that child, instilling it in that child? You know, it's out there for you, the same as that settled child you're sitting beside. So we need to instill that in our children in order for them to move on, move up the ladder. And for me, the way forward, I know we're going to do it at the end, Maria, the way forward is that we need liaison workers working within the schooling systems, within the council, within the HSC. And the idea, and it has to be a traveller Pacific liaison officer in order to know what it's like to be a traveller. what issues is coming up. We can read it from books. We can have as much books in front of us and as much Bibles and as much whatever we want, but it's coming from inside. We know best. We are travelers. We know what it's like to be a traveler. So for our children to feel comfortable, as Anna said, it's very daunting for children going to school, the experience of not knowing whether they're going to see their parents that evening. Well, we need to embrace that. We need to be a part of that schooling system to show that the solidarity is there for our children to have better outcomes in their life. And I suppose there's another word that really kind of gets me. I've heard so many times that we as travelers, we need to fit into our community, into society and community. Look, we live in a very diverse Ireland at the moment. We've so many cultures at the moment. We need to embrace culture. We need to, I won't use the word accept, because we should never accept. We should embrace culture. We should promote. People should never feel ashamed of where they come from. Anne knows, and I know, that is happening within the traveller community. There is a lot of shame to have it, because it's the way we've been treated. You know, and we try to pass down, I know I do, I try to pass down as much positivity to my children as I can, and try to ingrain that in them. You are as good as the next person. So for me, I think going forward, there is a lot of work to be done, but also I feel that I can be positive about it, because I know there is travellers out there that do want to get education and move into those areas of being like a liaison officer, which will make a huge impact.
And I know, sorry, Anne, go on.
Could I just go back a bit just for a minute to the ethnic identifier question that was posed? Again, going back to the last big piece of research that was done, the All Ireland Traveller Health Study, you know, if we'd had an ethnic identifier, we wouldn't need to go back. So there was some complaints at the time because it cost so much money and it would never be done again. But if we had an ethnic identifier, we wouldn't need to go back and do that big piece again. We would be able to track and mark, you know, the work that we're doing. So for instance, primary healthcare workers are working in all the different areas of health. But how do we know we're making any progress if we don't have an ethnic identifier? If we can't say, well, you know, somebody, so cardiovascular health has improved, we can see this, you know, through the ethnic identifier. What was the other big one? Respiratory health, you know, were the big ones that came out of the All Ireland Traveller Health Study that affect travellers. How do we know there's any improvements without an ethnic identifier? And the other thing that came out of the All Ireland Traveller Health Study, well, was the first time that I think it was really spoken about, was the social determinants of health. So I, at the time of this, I was sitting on a committee in the Department of Health when the All Ireland Traveller Health Study was finished, and they were saying, oh, that's great, now we've done our job. There was no rollout, you know, by the department. In fact, they disbanded the committee straight after the All Ireland Traveller Health Study. But the social determinants of health for me was a big one, an eye-opener. You know, all the departments need to get together. For me, it was a no-brainer. I said to the person who was leading that committee at the time, well, here we have it. You know, the Department of Health can spend as much money as they want on health, but health is also impacted by accommodation, by employment, you know, so let all the departments get together. And he was taken aback by this. And he said, oh no, hang on a second. We don't tell other departments what they should or shouldn't be doing. But I said, that's a waste of public funding. If so much money is going into health, but your health is being impacted by accommodation that's not being improved, by education that's not being improved, then there's a real problem.
Yeah. And I suppose just speaking of that then on accommodation, like that, as yourself and Mary have said, like it just is the big issue that was brought up like by everybody on it, no matter if we were talking about education, if we're talking about housing, or just as it was always linked back into poor accommodation. And Michelle, maybe you can just talk a little bit about what we found in terms of accommodation.
Yeah, so another one of our reporters, Cormac Fitzgerald, actually took on the housing piece, which was a big endeavour, I think. And in the course of his research for the piece, he actually found out about an outbreak of hepatitis A at a housing site in Dublin, which was most likely caused by unsanitary conditions. Now, at least 5 children were hospitalised, and the Ombudsman for Children was alerted to the site's condition. And I think this is a good example, and it was a good sort of indicator for us to use in that piece of how health and housing are linked together. And in fact, housing is really linked, as you said, to all of the pieces. I mean, we saw that with the conditions that children were living in during COVID. One example from the children's groups, there were a couple of boys, and they would be in the 12 to 14 age group, who, I mean, they're living in very overcrowded condition. They usually go to their grandparents' house to do their homework. They usually go to their grandparents' house to shower as well, because they don't have a shower where they live. During the pandemic, because their grandparents were older and they were trying to keep them safe, they no longer had a place to shower, so it affected their sanitary conditions. It also affected their schoolwork. If they had even been sent work, which actually these boys hadn't, but if they had been sent work, they wouldn't have had a space to do it, because they're sharing a very small bedroom with a sibling. Their youngest siblings are in the bedroom with their parents. It's only a 2-bed place they're in, and it's a very small living space they're in. That has impacted on their education and their health. Now, I also mentioned earlier a report from the Ombudsman for Children on a core culting site, Spring Lane. That report highlighted overcrowding and unsafe conditions, and the report stated that there was a high rate of childhood illness that was caused by living conditions. Now, as part of this investigation, traveller advocacy groups have said nothing substantial has been done to upgrade this, and that report was out in May.
Yeah, and Anne, you worked with travellers from Spring Lane and actually lived there for a period of time yourself, and the Traveller Visibility Group has campaigned for improved conditions for years. In fact, we asked for FOIs, and a lot of them were from the Traveller Visibility Group to Cork City Council, saying what is happening with Spring Lane, or raising issues with Spring Lane. So maybe you can tell us a little bit about what it's like on the ground now since May, and if there's been any action.
Yeah, there hasn't been much of a difference. I don't work specifically on accommodation, but my colleague who does work has told me that what's happened since is that there's been 2 new welfare pods put onto Spring Lane. There's a bit of upgrading of the footpath for the children to go to school. There's work on upgrading the public lighting there. There's also 2 people, I think, are doing a needs assessment, an accommodation needs assessment in Spring Lane at the minute, but there
maybe
hasn't been
you
any.
can just tell a little, maybe people aren't familiar what welfare pods are, maybe.
So Spring Lane is a 10-bay halting site that was built in the late, I think in 1989, and so it started off with a 10-bay site. It's been overcrowded. It's been chronically overcrowded since the word go, you know, and there's now 40 families all around the periphery of it as well. So some of the families now have received welfare pods for the first time, a toilet, a shower, you know. So that's basically what a welfare pod is. But the history of Spring Lane, again, you know, again going back to the lack of so that whole area around Spring Lane was always traditionally a traveller camping spot. My great-grandparents would have camped there, they would have lived there. And the city kind of came out to meet it, and housing estates grew up around it, you know. So you had a large amount of travellers living in a wide space that was there. And the local authorities, and this is again part of our history, we weren't consulted, you know. At the time there were settlement committees with nuns and priests that made decisions on our behalf. So basically one day, you know, we found out that we're building a site in there, and it's actually in the quarry. We lived in the wide space, but actually they built the site in the quarry where it's damp. Like summer and winter, it's damp inside in this specific place. And I think the thinking was, travellers aren't going to stay there anyway, they're going to move on, you know. A politician told me afterwards that they had it earmarked for an industrial estate, so they never had intended that travellers were going to stay there. So it progressed like that, you know. It was overcrowded from the word go. When the site was finished, they came down to the group of travellers that were there and said, look, you know, the site's finished, head away up, because we're going to move you from here if you don't. So it was like a stampede from the Wild West. Travellers headed up to the site. As I said, it was overcrowded from the word go. And then the Trespass Act came in 2002, and travellers living around Cork had no place to go. They came into the site as well. And the site just became chronically overcrowded. And my family left in a few years ago, and I suppose we had been talking to the local authorities for years about future plans, you know, for our children that were growing up there, group housing schemes, other sites. In fact, there has been no additional accommodation built in Cork for travellers for 25 years, you know. So we have 4 halting sites in the city, and there was no sitting down and having a plan for what's going to happen to other travellers. And on top of that, we weren't given houses in local authority estates either, you know. Where we were supposed to go, I don't know. And that's what led to Spring Lane being, there was no management. I know people aren't going to believe this, but we actually went down and asked for rent books so we could pay rent, because we knew that if we didn't pay rent, we wouldn't have any rights. So we had to ask for that. And again, when the site was built, there was a big splash in the local paper, the Echo, you know, that it cost 500,000 to build this site. When we went into it, there was no bathrooms. There was a stainless steel toilet. There was no bathrooms. So I suppose that was my first journey into traveller activism. I went down to the local authorities with a group of traveller women from the site, and we said, look, there's no bathrooms. And they said, oh yeah, we were giving you a probation period to see did you break the site up before we gave you bathrooms. So then we said, but we need bathrooms for our children. And that took another 2 years. And then they gave the tender out to somebody else. And then there was another big thing in the paper about how much the bathrooms were costing on the site. And just from that, then there was no management of the site. Like a settled person couldn't decide, well, I'm going to move on to another housing estate and pull my trailer there. You know, we couldn't do that. But what happened in Spring Lane was, you know, I would stress that. I mean, you can understand it. People couldn't. It was effectively made illegal to be a traveller anymore. So travellers came on to the site, and since then, for the past 20 years, it's been chronically overcrowded and it's been overlooked. And in spite of all the campaigns that we've had and the engagement that we've had with the local authorities, very little movement. And then you get the OCO report, and all of a sudden there's a bit of movement. And our real hope is that this will be the start of something, a better life for the traveller children and the traveller families living on Spring Lane.
Yeah, and like, because obviously a huge amount of media publicity has been on Spring Lane, but Mary, like, it's not just Cork or Spring Lane that these issues are happening. Like, maybe you can tell me a little bit about how, from your work, like the living conditions and how they impact health.
Well, I suppose in Longford, like, it's right across the board, but Longford also is well up there with issues and problems. I'll just give you an example. I worked, this is just one Pacific lady, I worked with a traveller woman going back last year. She was living in very bad, poor conditions. She had made it known to the primary healthcare team, so we worked long and hard trying to get her sorted. But basically, she was living in a house that was actually damp, cold, there was blue mold, there was all black spots on the ceiling, which I seen with my own eyes. She had 5 or 6 children. She had one child that had asthma, which we know dampness is one thing that we cannot have. She had heating on, there was no heat, she was trying to keep her little child warm. So I suppose this is what I took from it, and this is what she said. This is what she actually said. We're looking for a nice warm, not a damp house with the ceiling full of black dots and the cold air coming in, with the mother doing her best to keep her children and child wrapped up warm. You know, in this day and age, in 2021, you know what I mean? We're not talking the 60s and the 70s. We're talking in 2021, to think that this woman, this mother, this traveller mother, wife of her 6 children, her priority in her life to make sure her children were safe and healthy. How could she do this in these circumstances? And like, also going back with Halton sites, we have one here in Longford, you know, overcrowding, you know, rats running around the place, you know, there's young children living in that environment. So like, in 2021, we should be, with all the technology, with all the different groups that speaking out on traveller accommodation, traveller health, like, we need, as I said quite clearly in the beginning, to stamp out all this inequity among the traveller community. Like to think, I suppose, coming from the traveller community, who'd ever think in this time that we'd be living in such dire needs? You know, all the health professionals, with all the stuff that's out there, and the links that the primary healthcare have come up, like, the travellers are using our services more and more, and we see that more on the ground as we are on the ground working within the community. So our accommodation is definitely detrimental to our mental health, our physical health, right across the board. How can we interact? How can we go into schools? How can we go and get jobs? How can we actually have just a basic living of standard? They're not looking, like the majority and all travellers, they're not looking for any luxury items. They're looking for the basics of what the next person has, which is running water, toilets, a bath, and a roof over their heads. And I think even looking at some of the facilities that the council have put in place in other areas, that they don't have members of the traveller community sitting on these committees, and if they do, are they allowed to speak? Is their voices being heard? Like, I see so many, like, it makes me think, halting sites right across Ireland with no play areas for the children. What about the children? Okay, we're talking about the adults, but what about them children? They are children, they need a place to play, they need a safe place. not up in where maybe there might be rubbish, and not due to the travellers putting it there. Other people coming in, putting it there. You know, glass, rats, all this has a huge impact on our children. You know, and I'll just give you an example. Like 36% of Irish people would avoid travellers, okay? 97 would not accept travellers as members of their family. 80% would not accept travellers as a friend. 80% of the population would not accept traveller as a friend, and 44% would not want to be members. They would not want the traveller community to be members of their families. How high is that? You know, it's numbers. Okay, we're reeling off numbers, but when you look at it, imagine 80% of our community right across the board would not want to be friends with travellers. How heartbreaking is that for us? How heartbreaking is that for us, for our children, you know, as Irish citizens, you know? And even, I know from one of them, they going back, I think it was in 1963, one of the amendments, one of the things that they came up with there was, we'll take the traveller out of the traveller child. We'll get that child to school and take. Why would they want to do that? You know what I mean? Have an understanding, equality, respect. That's all we want.
Yeah.
And a good standard of living. Good standard of living.
And Mary, that was something, as you were even talking, I was writing down, you know, so much of what's happening to us stems from the assimilation policies of the 1960s, you know, and what I feel very strongly from people who work in the different agencies, you know, and the services, is an almost a resentment, you know, like, we gave you everything. We gave you every opportunity to be like us. All you had to do was assimilate. All you had to do was be like us. And you keep refusing, you know, what are we going to do with you? What? Look, this is the system, and this is the way the system works. And there's such a lack of compassion when it comes to travellers with workers, because I've seen it. I've been in queues in agencies like the local authorities, in different places, where when it comes our turn, the attitude changes completely, you know. So the training that people get to work with us, the cultural competency training, there's a big deficit there, you know. We have a family in Cork here, and it's so hard to believe that 17 years they're on an unofficial site. Their daughter had a brain tumor. And when the daughter came out of hospital, they provided one of these pods. So she had to walk out into a pod to go to use the bathroom and use the toilet. Since then, the father has become very ill as well. He has a cancer diagnosis. And the local authorities waited 17 years. And because IRAC brought a case, they waited. And on the steps of the courthouse, they made a decision that we're going to do something for that family. Why does it have to go that far when it comes to travellers? Where is the compassion? Where is the understanding when it comes to travellers? And who advocates on our behalf if it's not us? And I hear from you as well, Mary, you know, I suppose the fatigue, the worn outness, you know, that we all have. We're all frontline. We have to go in there to travellers. We have to make promises to them that we can't keep, that we know we can't keep. What can we offer them? What can we say? You know, they're saying, well, you know, the travel organisations have been around for 30 years. You know, what's changed? What have we been able to improve? You know, where's our public representation? Who represents us in the Dáil? You know, I know we have Eileen O'Flynn in the Seanad, but why can't there be a politician that comes from our community? You know, why can't we all vote for a TD that represents us, that looks after our needs, that makes sure that traveller policies are traveller approved, you know, or any policy is traveller approved before these policies come in? Look at all the negative policies that has come through the Dáil, you know. Why can't we stop that? Why can't we have somebody in there speaking on our behalf? This is
Can I just Mary, go back to that? Just saying to Anne, like, all the work we're doing, like, we do see improvements. We are voicing our opinions, and I think going forward we need to continue that, and we need the younger generation coming up to take over from where we are at, I suppose, when we retire. So hopefully before 66. But like, going forward, we need role models in our community. That's the huge part. We need role models to show that we can, as a traveller community, as a society, that we can do as much as the next person, and to put value on our culture, and not to feel the shame. Or, like, even I've come across traveller families that actually they don't want to be known as a traveller. And that's not because of them, it's because of how they have been treated. They don't want their children to go through what they have gone through. You know, it's heartbreaking. It is heartbreaking. We want our culture to stay alive in our children and our grandchildren. We want
Yeah.
them to be proud. We don't want this shame. We
Yeah.
want to have good mental health within our community. We want the suicide rates to drop. We want the respiratory problems sorted. It can all be done with the help of each other and the statutory agencies like the government to take on board, not just give words. It's easy to sit and talk and give promises and say what they're going to do. We need action, and we need it now.
Yeah.
Yeah, and I suppose
Yeah.
speaking of that, Mary and Anne, like obviously from our entire discussion, it's very clear that the disadvantage with children is going back generations. And I suppose you kind of touched on it there, Mary, but for both of you, like, do you have optimism that this cycle of disadvantage will be broken for this generation of traveller children, or are we talking kind of further than that? So Anne, maybe you can talk about that.
I think Mary might be a bit more optimistic than me, but from what I am seeing, I'm not hopeful for that, Maria. No, I'm not. I just don't see it on the ground. I see it being at crisis level, without action now. I suppose that's the word, I am so tired of sitting on committees. I am so tired of the talk and the rhetoric and all the stuff that goes on with no actions. I want to see a National Traveller Education Action Plan. I want to see a health action plan. I want to see targets. I want to see somebody taking responsibility for it. But I don't see that at the minute. I don't see it happening at the minute. We've been waiting for years for these plans. Where are they? We keep being told, they've been finalized, they're being this, but it's going to be too late for another generation. If we don't start working, if we don't start addressing and responding to these needs now, it's going to be too late for this generation.
And Mary, how do you feel?
Okay. I think I want to be a bit more positive. I really do, because I've been sitting on so many committees in the last, I'm working over 18 years, I suppose, within the primary healthcare. I'm working for the last, I suppose, 6-7 months as a community development work, which I love. I have to say, I love working on the ground. It's hard work, but I love it. For me, I think definitely, for me, I want to be optimistic. For my children, they're in their late 20s and early 30s. For me and for my grandchildren, I definitely want to see an improvement. And I think we will. I think definitely with all the voices, with us all working hard together, highlighting it, and especially with Maria, with yourself, Michelle, you're getting it out there, you're putting it public, we're having public publicity. So for me, look, quality of engagement, that's number one, from both the traveller and the settled agencies, government, whatever. Links between the healthcare services, links between the housing departments, links through the education system. Again, a liaison person, a traveller working in these areas will definitely make a change. We need to see travellers in these roles in order to make changes, because they have lived it. We have lived it. So if we're living something, we are passionate about it. We know where the downfalls are. We know them. So by us in there, we're the professionals at that. Okay, it's a very odd time you'll hear travellers saying that they are professionals, but believe me, when it comes to the traveller community, we can be no better advocates because we have lived it and we are living it, and we want improvement for our children. So I think to build, the most thing as well, I think, is to build relationships, good relationships, okay, within the schools, the health, the accommodation and work. We need that. Like, for instance, I'll just give you an example. I know I give an example, but the law is there. The guards are there to do their job. If I'm speeding, I'm going to get a speeding ticket and I'm going to get penalty points. Likewise with a safety belt. Likewise if I go through red lights. If I don't have an NCT in my car. What's there? The employers have this, as far as I'm aware, they have these things in place, like we have to, we can't discriminate against any race, creed or colour. That's not happening. What's happening to them? There needs to be consequences. When employers employ young traveller, males, females, middle-aged, whatever age group it is, there has to be consequences, and it has to come from the government. What sort of consequences can be put in place for these employers? Not just to tick a box. We're not discriminating against the traveller community. Yes, they are when they are employing that traveller. If that traveller is listening to being called a knacker, how is that affecting that young male or female mentally, physically, able to come home and have that in their own head that they feel worthless. So for the employer going forward, that's something we must look at. For the employer agencies, for right across the board. So I think and then cultural awareness. Okay, we have talked about it. I know it's ongoing, but that's a huge part of going forward as well. Our teachers, our doctors, our nursing staff, our hospitals alone, for young women going in to have their babies, sometimes the treatment they get. Like, I've heard so many stories. Like, I'm a traveller myself, and to hear the stories, my heart goes out to them.
Yeah.
You know, it's just heartbreaking. But going forward, look, we need to be positive, because if we're not going to be positive, you know, like, what's the point of having all these meetings, highlighting all this? Going forward, I genuinely think there will be a change. And it's up to us as individuals to keep doing what we're doing. No matter how tired we get, no matter how many wrinkles we get, we have to continue and to show that we have as much entitlement to be on this island as anybody else.
Perfect. Thanks very much, Mary. We'll wrap it up there, but as like so many other travellers have said to us as well, it's action that is needed, and not more and more reports, but plans and action. But thanks so much to Mary and Anne for their time and their absolutely brilliant contributions today. And thank you for joining us for Tough Start Live by Noteworthy and the Journal. And obviously thanks to my colleague Michelle for joining us today as well.
Can I just finish on one little thing when we finish, just from a traveller girl? It was a little poem, but I won't read it all because it's quite long, but I'll read the last paragraph. This was a 6th class student. She was about 9 when she wrote this, and it just makes us think. Oh, it's just the last little paragraph. Oh, how I love school when we have good days like this. Even though I'm a traveller girl, we still can have the same fun.
Thanks, Mary. That's a very powerful poem, I would say. And thanks again for everyone for joining us. And I'll just finish by saying, if you want to learn more about our work at Noteworthy and how we source our stories from you, head to our site at noteworthy.ie and sign up to our newsletter, which gives you an insider look at the latest investigations by visiting noteworthy.ie/newsletter. And thanks again for joining us today.
Thank you. Thank you, Maria. Thanks, Mary. Thanks, Michelle.
Thanks, Michelle. Thanks, Maria.
Bye.